I'm Adam Grundy, Head of Occupational Health and Wellbeing at Sherwood Forest Hospitals. As an organisation, we strive to look after the wellbeing of our colleagues through good times and bad, but we know that healthcare is difficult and often has an impact on our health and wellbeing. But we also need to acknowledge that at times the way we act as managers, leaders and as an organisation has an impact on wellbeing of colleagues as well. Although this type of harm to colleagues is often unintentional, we know it has a great impact sometimes. Over the last 12 months, a picture has emerged within the occupational health and clinical psychology services that suggests more and more colleagues are presenting with mental health related illnesses associated with their work, but exacerbated by a lack of compassion and empathy. This is not always from one-off actions, but often a cumulative effect over time. We know that the organisation must take certain steps to ensure the safety of patients and colleagues, and that those processes can be distressing for colleagues. But what we want to focus on is the way managers and leaders enact those processes. Simple things such as having more consideration around when colleagues are communicated with and how can have an impact on wellbeing. Openness and honesty with colleagues, acknowledging when we can't provide an answer or information, can help individuals to process their experiences. As an organisation, we know that we strive to provide a wide range of support for colleagues in distress, whether that's from the occupational health and wellbeing services or the people operations team. Support is there. We also know that there are some great examples of leadership within our organisation, and we want to help others to mirror that behaviour. As a service, we feel that the changes needed are simple ones, changes that we are all able to implement and that cost very little to achieve. Specifically, we feel that if as an organisation we support more of our managers and leaders to engage with the available wellbeing and development training, we can help them to support colleagues managing difficult situations and avoid adding to their distress. Training such as wellbeing conversations and react mental health training should help managers and leaders operate in a more empathetic way to support colleagues. We're already seeing colleagues who have engaged with this support start to develop their leadership journey into a more positive one for the benefit of their colleagues.
Hi, my name's Leanne Minert. I'm currently a Quality Governance Matron for Governance Support Unit. Prior to this, I was ward leader in a very busy ward environment, and I have to say I was very blasé about sickness and absence within the area until I became a ward leader. My viewpoint changed within sickness and absence as it was so high on the area. So I thought to myself, how can I support my staff to be at work? How can we reduce sickness and absence within the workplace? And that meant me spending time with individuals, looking at whether they needed referral to occupational health, looking at reasonable adjustments, any flexible working needs that that person required, and just generally exploring why a person was sick, off work. It might not be that they were sick themselves, it might be for other reasons. Because of this change in my mindset, I was able to reduce sickness and absence significantly within a few months on the ward, and that in turn increased staff morale. It strengthened staff relationships together and subsequently improved patient care and my relationship with the staff on the ward. In my current role as Quality Governance Matron, I've supported an individual through my vast experience as a ward leader to support this individual to be at work, and that has meant referring to occupational health, showing that there are other services out there to support this individual. We've looked at the flexible working policy and any other reasonable adjustments, and in turn, in the last year, they have had minimal absence due to following the sickness and absence and wellbeing policy. It is key to be compassionate, listen, and make time for these conversations.
My name's Paris Wallace and I'm the ward sister on Ward 32. Being a ward leader is a highly demanding role. One of the main challenges that I've found is how isolating the role is. As a leader, I have to make decisions that impact the staff, the patients and the ward environment as a whole, and that can be really overwhelming at times. I've come to realise that I'm not alone in the challenges I face. Through building a strong support network in other ward leaders, coaches, professional nurse advocates, and engaging in leadership courses, I've managed to gain invaluable insights and reassurance that I'm not alone. These connections have allowed me to share experiences, problem solve, and ultimately feel supported in building personal resilience as well as being a more effective leader. Another key element that has helped me to build a more cohesive team is having one-to-one meetings with the team. These sessions, they give me the opportunity to understand what each individual values, their unique challenges, and how they prefer to contribute to the ward's goals. By bringing those individual perspectives together, we've been able to work as a collective in a more harmonious and effective way.
We've heard from colleagues about the importance of talking, listening and caring for each other. Sometimes we have to take our colleagues through policies or procedures and protocols. The way in which we do that can make a huge difference, doing that with compassion, for example. Thinking about you as a leader and a manager, I would like you to consider booking on to the leadership programme, our Wellbeing Conversations training and our React Mental Health Awareness training so that we can support you in having those wellbeing conversations and those crucial conversations. Thank you for listening.